Okay, phase two. I'm going to be doing bend and lift patterns with the lower extremity alignment exercises. It's actually two exercises, so it's going to take a little bit longer and don't want to bore anyone. So let's make it group participation. If you want, you can join along. We're going to be seated in a moment and you're already sitting at your desk probably. So you can do that. You don't need a lot of space. There might be a couple tools if you have right nearby we can grab later on. But so we're working on alignment with the lower body. Before we do that, let's do a little warm up. All right, Simon says, touch your deltoids. Simon says, touch your bicep. Simon says, touch your anterior superior iliac spine. Okay, did you get that one? Put a thumbs up in the chat if you got that. Here's how we find it. Don't worry if you didn't get it. We're gonna put our hands on our hips like we're upset with someone, disappointed. Now that bone we feel on our side here, the hip bone, that's the iliac crest that sticks out the most. So palpate that with your two fingers, find where it's most prominent. And then we're gonna kind of trace, follow it distally down towards your feet and in, and it's gonna start to kind of disappear in more deeper into your body. That's where it starts to go in. That's the ASIS. That's the anterior, the top part, superior. No, anterior is the front part, superior is top, iliac, the bone we're dealing with, the ilium, and the spine, the ridgy part of that bone, okay? So why is that important? Why are we doing that? We're gonna use that as a landmark for alignment. We're aligning that with our knees and with our second toe on our foot, okay? So I'm gonna talk about a little bit why we're doing this. So in the meantime, if you have one of these kind of stretchy TheraBands nearby or like a softball sized exercise ball that you can squeeze, you can grab that. And we'll talk a little bit about why we're doing this exercise where we are. So squats and those kind of bend and lift movements, super, super, super important, but also super complex. They seem simple, like just bend down, get back up. But we're dealing with the glutes and the quadriceps, very large, powerful muscles, the hamstrings. They can do a lot of energy and create a lot of force on a lot of these joints and our back that can be negative if they're not in proper alignment. So we need to get everything in line with our patient, our client, ourselves when we're doing these exercises, right? If you remember, when we did the screens, the bend and lift screen, that one, we did many reps and we're looking for different deviations at different angles, looking from the side view, the sagittal view, the front view. So we're looking at the feet, we're looking at the knees, the hip, all the way up to the head. So when you're doing a squat, there's errors that can occur and cause deviations all up and down your body. So it's vitally important that we get it right from the beginning. And we start with that with just this lower extremity alignment. Okay, so like I talked about the three joints, when you're doing the squat, we're on our feet. And so we have our ankle joint, right? That's a hinge joint, does plantar flexion, does dorsiflexion, but it's also doing eversion, inversion, and supination, pronation. So it has that play to it where it can go in a lot of directions. And so on top of that, and you have your knees, not the most stable. You have lots of ligaments holding everything in place. They have a lot of mobility, even though they're a hinge, they can go side to side and twist. And there's some translation there that can happen when you get up to your big hip joint, right? So in the acetabulum, now that we have a ball and socket, now we really have freedom of movement. 3 degrees of movement. We're going in all 3 planes. We can circumduct, and you can do all sorts of combinations with those joints. If you go to YouTube, if you really want to see how complex the body can be and what it can do, find like a world-class sprinter, a hurdler in the Olympics, something like that, and slow down, super slow-mo, 0.25 speed of them going over the hurdle at the hip, at the knee, at the ankle, bending all the things that they're doing, very complex, very fast. So it's pretty amazing. But we're not just doing this for our elite athletes. It's really, we want to have activities of daily living for people that need to get off the toilet, people that need to bend down and get something from the bottom shelf of the refrigerator. So bending and lifting happens every day, all the time. So we need to make sure everything's in line for everybody so that they can just do daily living activities, right? Okay, so back to those bend and lift screens. One of the common ones we saw, and I saw it with some of my classmates, when the squat starts, the knees start to cave in, right? So we call this knee valgus. The knees kind of come together like they want to kiss each other on the side, right? It happens a lot with heavy squats. You see bad form like that happen all the time. So it's a problem usually with the hip abductors, your glutes medius, glute minimus on the side, the tensor fascia latae. So that's one area that this exercise is going to be able to help us with. So if you have a band, you're going to have your client seated. Get a tight core so we can have a nice neutral spine. Make sure we're standing up straight. My dog is bringing me a ball to use. Thank you, buddy. I think he wants me to throw this one now. I got another one. So we're in alignment, straight. Find your ASIS, knees, second toe. Put the band on. Above the knees, around the quadriceps there. So that alignment area, that's going to be the end range of our reps, okay? This is going to be an isometric hold. So when we start and we're relaxed, we start from this position, and we're just going a few inches. That's the concentric portion. And this is the isometric hold that we're doing. We're going to hold that for 2 seconds. And as you release it and you do the eccentric, the deacceleration phase, you can inhale. And as you go into that concentric and you're accelerating, you can exhale. Now, to make it a little bit harder, we can progress to when we get to that isometric squeeze part. Now we're going to engage the core, make sure the hip hinge is working, and do a stand up while we're holding that isometrically. And then relax. Back to the contraction, isometric hold, and stand. Maybe another progression, we can add some monster walks within that range of movement. And once we get into that alignment, maybe a little pulse squat. Do both sides, right? If we want to make it easier, obviously no band, we can do supine, lying down, just legs, abduction. Remember with abduction, AB, we're taking the leg out, away. So the agonists when we're doing abduction exercises are your glute medius, glute minimus, tensor fascia latae. So the antagonist, the muscle that's kind of lengthening while we do that, it's a lot of them, okay? So we have the brachialis that goes all the way down from the hip past the knee. You have your abductor magnus down here, attaching on the femur, abductor brevis, abductor longus here, pectineus, and I'm forgetting one, obturator trenis. So bunch of muscles, a mouthful, right? We can call them adductor muscles for now. So your abductors pulling out, adductors, these groin muscles pulling in. So for the adduction, if we have maybe a weaker groin, because some of those muscles could have got strained, lots of times hockey players get that strain from that skating motion. People that slip real suddenly can hurt these muscles. When you hurt them, they're a pain in the butt to rehab from. They take a long time, lots of re-injury. So you might have someone with atrophied muscles in those areas. So now we're going to take a dog toy ball, or if you have a better ball, that's awesome. And put it in that stability range again, lining everything up. But now we want to make it so that when we squeeze, then we're in that alignment, okay? So it's a small squeeze, isometric hold, relax, so it's eccentrically slowly coming out, and we're inhaling. Then we concentrically accelerate through, isometric hold. Now we're progressing. Same as last time, standing up, holding it, okay? We also could try adding a weighted medicine ball, so that while we squeeze isometrically, we also have some gravity to work against. With this exercise and the previous one, we can also move on to the figure 4, getting people into that proper tibia back alignment, and then onto other squat exercises. Again, if we want to regress on this one, just lying down, when we're sitting up, abduct and adduct, emphasizing squeezing on those muscles. So a lot of the common errors with both of these would be just doing it too haphazardly, especially with bands. People want to stretch them out and play with them like a rubber band. We're not doing like clamshell, like very large ones, because we're trying to stay in that alignment. So we want to have controlled movements within that small range of motion, emphasizing getting in alignment, keeping the core tight and upright with the spine. So that's a common error. Not breathing through the exercise the proper way would be an error. We want to do 2 sets, 10 reps with this. And I think that's it. Let's finish with our cool down. Simon says, touch your ASIS. Simon says, touch your triceps. Simon says, flex your nasalis. Okay, thumbs up if you got it. Thanks, guys.